Hello everyone. Today we will discuss about the metabolism and different states of the body, part 3. Here in this we will particularly discuss about the metabolic changes during the pregnancy, lactation and during the trauma and critical illness after surgery. Now first of all, the metabolical changes occurring during the pregnancy. Maternal physiological changes in the pregnancy are the normal adaptation that a woman undergoes during her pregnancy to better accommodate the embryo or the fetus. They are basically physiological only, that means they are entirely normal. Okay, but if they actually increase or cross the limit of their particular increment, okay, then it can cause damage or destruction of the particular body formation and the metabolism. Now these changes include the CVS or the cardiovascular changes, hematological changes, metabolical changes, renal and the respiratory changes. Now remember, these all changes are basically normal during the pregnancy. Okay, but they actually over exaggerate during the particular period of pregnancy. Then it can cause problem to the mother and the fetus both. Now first of all, the normal hormonal changes. Now level of progesterone and the estrogen rise continuously during the pregnancy time. Okay, and they actually suppresses the hypothalamic axis and subsequently the menstrual cycle. Of course, we all know that the progesterone increment and the estrogen increment in the during the pregnancy basically inhibits the menstrual cycle. Estrogen is mainly produced by the placenta. Remember this over here in the pregnancy time, this is basically formed by the placenta and is associated with the fetal well-being. Now the placenta also produces the human chorionic gonadotropin hormone. Now this basically maintains the progesterone production by the corpus luteum. This HCG actually maintains the progesterone production by the corpus luteum during the pregnancy. Now increased progesterone production first by the corpus luteum, okay, and then later by the placenta actually causes the relaxation of the bronchial smooth muscles during the pregnancy time. Now the prolactin hormone. Now, prolactin hormone level increases due to an enlargement of the maternal pituitary gland. Now this basically mediates a change in the structure of the mammary gland from ductal to alveolar, all the things. Okay. Now also the PTH or the parathyroid hormone also increases during the pregnancy, which actually leads to the increment in the calcium uptake in the gut and reabsorption of the calcium by the kidney. Now also the adrenal hormones like the cortisol and the aldosterone are also increased during the pregnancy time. Now these all changes basically occurs further in the during the pregnancy in the mother. Now first of all, the CVS or the cardiovascular system changes. Now during the course of pregnancy, blood volume slowly increases by 40 to 50%, mainly due to an increase in the plasma volume. This is basically mediated by an increment in the aldosterone level in the body. Now it results in an increase in the heart rate by 15 beats per minute increment during the pregnancy, and the stroke volume also increases. The cardiac output rises from 6 to 7 liters in the second trimester. Now next is the hematological changes. Now during the pregnancy, the plasma volume increases by 50%. Only before only the plasma volume increases by 50%. Okay, and also the RBC volume increases by 20 to 30%, and because of this there is an increased risk for development of the blood clots and the embolisms due to increase in the production of the coagulation factors like the fibrinogen or the factor number 8. Now this hypercoagulable state during the pregnancy along with the decreased ambulation actually causes an increased risk of both DVT, that means the deep vein thrombosis, and the pulmonary embolism. Now next is the metabolic alteration. Now during the pregnancy, both the protein and the carbohydrate metabolism are affected. About 1 kilogram of extra protein is deposited, with half going to the fetus and other half going to the uterus. The fetal development of the growth needs extra nutrition to the mother. Now next is the nutrition level. Now pregnant woman requires an increase of 300 kilocalories per day of energy and about 70 to 75 gram per day increment of protein per day. Okay, and also there is an increment of the folic acid requirement from 0.4 to 0.8 milligram per day, because if there will be deficiency of the folic acid in the pregnancy, at that time it can cause the neural tube defect in the fetus. So that's why particular and the required amount of folic acid should be provided to the mother, so that there won't be any kind of neural tube defect in the fetus. Now next is the renal function. Now during the pregnancy, what happens is the GFR rate the glomerular filtration rate actually increases by 50%. Why? Because before only the plasma level in the body of the pregnant lady actually increases by 50% and then returns to normal around 20 week postpartum. Now there is because of this there is decreased blood urea and creatinine level, of course, because there is high plasma level in the body, and there may be transient glucosuria seen in the pregnant woman due to the saturated tubular reabsorption. Okay, there will be transient or the temporary glucosuria. Okay, now but if there is persistent glucosuria, this may suggest gestational diabetes mellitus. Okay, and also over here the renin-angiotensin system is upregulated, which actually causes the increased aldosterone levels. Also remember, we have two very main important terms, that is the preeclampsia and the eclampsia. Now what is preeclampsia? Now along with the urine albumin, if the pregnant lady is hypertensive also, now this condition is known as the preeclampsia. And what is eclampsia? The combination of the pregnancy, urine albumin, hypertension and the convulsion is known as the eclampsia. So remember, what is preeclampsia? Urine albumin and the hypertension in the pregnant woman is known as the preeclampsia, and the combination of the urine albumin, hypertension and the convulsions in the pregnant woman is known as the eclampsia, and the eclampsia is actually deadly condition. Now next is the metabolic changes during the lactation of the woman. Now what happens over here, the major synthetic process during the lactation is production of the milk, of course. Now very important, the placental lactogen and the maternal prolactin are the hormone stimulating galactopoiesis, and these both hormone actually stimulates the galactopoiesis process. What is galactopoiesis? It is basically a term used for the maintenance of the milk production. Okay, now also in the third trimester what happens is a woman's body actually starts producing these types of hormone and thus stimulating the galactopoiesis, that is the hormone that stimulates the or maintains the milk production. Now glucose is basically used to synthesize the lactose and the TAG or the triacylglycerol, which are the major energy source during this time. Amino acids are basically taken up for the photosynthesis, of course. If the mother's nutrient intake is insufficient, proteolysis, gluconeogenesis and lipolysis will supply the substrate for the milk production, and this can lead to maternal malnutrition and the poor quality of the milk. Now the prolactin during the lactation time contributes to the increased growth and differentiation of the alveoli and other ducts in the mammary gland. High level of prolactin during the pregnancy and breastfeeding also increases the insulin resistance. During lactation, prolactin is the main factor that actually regulates the milk production. So don't get confused between the prolactin and the oxytocin, because the prolactin actually causes the milk production or actually regulates the milk production, but the oxytocin is necessary for the milk ejection or the milk ejection reflex in response to the suckling. Okay. Now also very more important thing is that at the high level of prolactin during the pregnancy and the breastfeeding, there is increment in the insulin resistance in the body. Also the progesterone influences the growth in size of the alveoli and the lobes in the breast. Also the estrogen stimulates the milk duct system to grow and differentiate. Now remember, progesterone actually influences the growth of alveoli basically, while the estrogen actually helps in the production and differentiation of the milk duct system. High level of estrogen also inhibits the lactation. That's why if the lady wants to inhibit her lactation, so she can have the pills actually having the estrogen or the high estrogen level pills she can have. Now very important term, that is the galactorrhea. Now what is galactorrhea? It is actually the milk production unrelated to the pregnancy or the delivery. It can occur because of the result of hormonal imbalance such as hyperprolactinemia. Now the metabolic changes in the trauma and the critical illness. Now response to the trauma includes various endocrine, metabolic and immunological changes. The severity of this change is basically related to the stress. The critical illness related to the stress is characterized by the activation of the hormonal response in the hypothalamic pituitary adrenal axis. Now thus we can say that the cortisol is basically released from the adrenal gland because of this excess. Okay, and in addition to this, epinephrine, norepinephrine, glucagon and G are also increased during the trauma or the critical illness after the surgery. And the oxygen and the energy requirement increases in the proportion to the severity of the trauma, of course, and the free fatty acids are the primary source of energy during the trauma. Now, triglycerides meet about 50 to 80% of the consumed energy after trauma and in critical illness. Metabolism has been shown to increase by 50 to 30%. Now, in the severe trauma, there is increased protein degradation to get more and more energy for the body requirement, for the body energy requirement. Now, the metabolic response to the trauma. Now, we have basically three main phases occurring during the trauma. There is the first stage is about the decreased metabolic rate in the early shock. Now, what happens in the first phase is that, first of all, the first phase develops within the 24 to 48 hours after the injury or the trauma. There is a decrease in the total body energy level and urinary nitrogen excretion will increase after this because there is no production of the protein but the degradation of the protein to acquire the energy. Catecholamines and cortisol are also increased during this time, and there may be hypotension due to decrease in effective circulating volume. Now, what happens in the second phase? This phase is basically about the catabolic phase. Now, second phase is basically for 2 to 7 days only, and in this phase, the metabolic response is directly related to the supply of energy and protein. Now, there is increased oxygen consumption and metabolic rate. The catecholamines are basically responsible for the increase in the energy production and consumption. Post-operatively, the utilization of the glucose is basically reduced due to the insulin resistance with an increase in the triglyceride and free fatty acid breakdown due to an increase in the catecholamine secretion. Now, basically over here in the stage 2, the main action is of the catecholamines only. So the phase 3 is about the anabolic phase. Now, what happens in the phase 3? The phase 3 of anabolic state is reached by 3 to 8 days after the uncomplicated elective surgery. However, it takes weeks after severe trauma and sepsis. This is known as the corticoid withdrawal phase, as because over here the corticoid are withdrawn and is characterized by the reduction of the net nitrogen excretion. Now, over here in the first stage there was increment in the net nitrogen excretion. Okay, but in the third stage there will be decreased net nitrogen excretion, and because of this we can say that during the third stage there is production of the protein and decrement in the degradation of the protein. The positive nitrogen balance ensures increment in the protein synthesis and a rapid and progressive increase of the weight and the muscle force. The late anabolic phase is basically characterized by the gradual restoration of the body protein and fat stores. It may take a few weeks to several months for complete recovery after a particular trauma. Now, what happens in the metabolic process of the body after the trauma? Now, oxygen and the energy requirement are basically increased in the proportion to the severity of the trauma. About 40% of the total body energy consumption is used for ion pumps and transport process so that they are easily able to transport whatever amount of energy produced by one part of the body to the another. The severity of the metabolic response and mortality can be predicted by the increased anion gap, particularly in the elderly patients. Now, first change in the lipid metabolism. Now, what happens over here is the free fatty acids are basically the primary source of energy after the trauma. Triglycerides provide 50 to 80% of the total energy consumed in the critical illness. The energy necessary for the increased gluconeogenesis is provided from either the lactic acid or the amino acid in the liver. Lipolysis is actually initiated and accelerated in the early period because of the increased adrenocorticotropic hormone, cortisol, catecholamine, glucagon, GH and insulin. Remember, these all hormones actually causes the acceleration and the initiation and the increment in the lipolysis in the body at the or after the trauma. Now, changes in the protein metabolism. Now, surgical stress results in an increase in the protein catabolism, of course, and the negative nitrogen balance and increased protein turnover. Okay, now the net changes in the protein catabolism and synthesis are related to the duration and the level of injury. The action is basically mediated by glucocorticoids. Now, this basically leads to an average of 1.5% daily loss of body mass because of the catabolism of the protein during and after the trauma. Now, over here, remember, mainly the glucocorticoids during the trauma are the main action or the action providing hormones in the body, the catecholamines and the glucocorticoids. Now the changes occurring in the carbohydrate metabolism. Now first of all, we all know administration of the glucose during the fasting actually reduces the protein breakdown and loss of muscle mass. Also, daily infusion of the 50 mg of glucose increases the fat oxidation and suppresses the ketogenesis process. The severity of the injury and tissue damage after trauma actually parallels the hyperglycemia. Why? Because during this trauma, or we can say pregnancy or any kind of other stress occurring in the body, the insulin resistance actually starts up or builds up in the body, and that will actually cause the hyperglycemia. In the early period of the first phase, hepatic glycogen stores are used for a period of 12 to 24 hours, because in our body there is only that much amount of glycogen is stored that can provide us energy for about 18 to 24 hours. Now after this, gluconeogenesis is an essential process that is driven by the stress hormones and cytokines. Also, the lactic acid is the most important precursor for gluconeogenesis. Lactic acid is a result of anaerobic glucose metabolism, of course. Now finally, the insulin resistance and the stress. Now in the stress conditions, there is secretion of the stress hormones like glucagon, catecholamines, cortisol and the GH or the growth hormone, and the inflammatory reaction generated by the cytokines, right? Now also the amino acid, free fatty acid and the glucose are released into the bloodstream from the various tissue in stress response. Now these reactions can be corrected with exogenous insulin therapy. Insulin infusion sufficient enough to normalize the glucose level and can be used as the final aim to achieve these reactions. Tight glycemic control will provide the outcomes of the critically ill people. So this was all about the metabolic changes occurring in the body at different states of the body. Just refer my first and second part also to know more about all these things. So I hope you understood well. Thank you so much.